Good morning, everybody. My name is Mordechai Dinnerman, and thank you very much. And we have a very special presentation here today with two very special people who are not only world-renowned for their minds, but also their hearts. And that's obviously something very important in Judaism and very important here at the National Jewish Retreat. Rabbi Yitzchak Breitowitz and Rabbi Dr. Edward Reichman both have very important work that they have done over the years, and some of you have heard them already at the retreat, and we thank both of you for participating. So this is the way it's going to work. This is a crossfire, which means it's questions to them. They're going to be giving brief answers, 2-3 minutes to each individual question. I'll start off with 1 or 2 questions, and then we'll turn to the crowd, and people will be able to raise their hand, and we'll point to you, and you'll be able to pose your question to the rabbis. I am going to ask both of you to repeat the question because the audience doesn't have a microphone. So if you're able to repeat the question before you begin your answer. In terms of, okay, so let's just get started. I'll begin with Rabbi Breitowitz. Rabbi Breitowitz, over the past few weeks and months in the United States of America, there's been a lot of noise in the media about Roe v. Wade. And a lot of attention has been placed on the question as to whether Roe v. Wade will be overturned or not. From a Jewish perspective, what would we say to the question of the overturning of Roe v. Wade? Is that a good idea or a bad idea, or is it complicated?
Well, that's always a safe answer. It's always complicated. I just want to say that obviously from pure halachic standpoint, and I mentioned this yesterday, halacha generally does not support abortion on demand, and this is true both for Jews and even for non-Jews under the provisions of the Noahide Code. So the superficial, simplest answer that one would say almost instinctively is that as an Orthodox Jew and as a believer that even non-Jews should follow the Noahide Code, I would be in favor of getting rid of Roe versus Wade and prohibiting abortion. That would be the simple answer, and my guess would be that that is probably the standard answer of most members of the Orthodox rabbinate, at least the more traditional, as opposed to the very left wing. What gets things very complicated is the following. I believe it is theoretically possible, and this is controversial, I'm not stating it as an established principle, that one could be absolutely against abortion on demand, but still is not in favor of the government prohibiting it. And the reason is the following. I'll give you one very simple reason. Judaism obviously permits abortion if the mother's life is in danger, for example. And pikuach nefesh includes not only physical danger, but even psychiatric distress and the like. Now, even if you had a secular law that said exactly the same thing, abortion is only permitted if the mother's life is in danger, once it becomes a secular law, the person that's going to decide if the mother's life is in danger is not going to be a Rav and not going to be a posek. It'll be the state's attorney of New Orleans or whatever it would be. And he may disagree with the halachic assessment. So paradoxically, there is a greater ability to keep halacha if the government has a hands-off position than if the government actively involves itself. So theoretically, one might argue that I could be in favor of a political pro-choice, even though morally, religiously, and conscientiously, I believe that abortion on demand is a very grievous sin. It's something that I grapple with myself, because on one hand, Maimonides does write that the Jewish people have a duty to further the observance of the 7 commandments of Noah. Indeed, this was the basis of one of the Rebbe's famous campaigns to that effect. But one might argue that we further the observance of Noahide law best by education, persuasion, and education, rather than legislation that is bitterly opposed, at least by a significant percentage of the United States. So if I leave you in total confusion, I understand it is a confusing issue.
Very interesting.
Before I begin, I just want to acknowledge Rabbi Dinnerman. He's a man who needs an introduction, although he really doesn't need an introduction. If you've ever taken any of the JLI courses, you have been introduced to Rabbi Dinnerman. He is one of the major brains behind all the courses that you take, not only deciding on what topics to cover, but researching them thoroughly, comprehensively, presenting them in a way which is absolutely superb and digestible and understandable to all. And he is really a large part of the reason why all of us are here and learning so much. So I just want to give him a round of applause for his amazing efforts. And I suspect the answer will be complicated, so you may as well cut and paste that for most of the questions we'll be getting today. But just to add to the complication, as opposed to something perhaps like assisted suicide, where there's absolute consensus amongst the Orthodox rabbinic tradition as to the prohibition, within abortion there is a spectrum, which makes it a little more nuanced and a little more complicated, and that spectrum exists within the Orthodox community in terms of when abortion is permitted and when it is not. The Mishnah explicitly states that abortion is permissible when the mother's life is in danger. So for a maternal indication, it is clearly permitted, but there is a debate amongst contemporary rabbinic authorities whether for a fetal indication, meaning if the fetus is afflicted with a medical condition and the mother is not, whether an abortion can be performed is a matter of intense debate. So that adds a little bit to the nuance and the complexity of the abortion issue.
Okay, thank you very much. Moving to another contemporary topic, we recently read in the headlines, Dr. Reichman, we'll start with you, about an Israeli flight attendant who died after contracting measles. And there's been a lot of attention to this. At the same time, there's been some awareness of the fact that there's something going on in the Orthodox community with vaccination. Can you please clarify what is going on?
What is going on with vaccination in the Jewish community? Very complicated question. Vaccination is about 200 so years old, 1700s with Edward Jenner. Vaccination is considered by almost all in the medical community to be one of the greatest advances in the history of medicine. In the year 2000, when they polled clinicians across the globe, what do you think over the last 2,000 years, the most greatest advance in medicine? Number one on almost all lists was vaccination. Just to illustrate that for you, how many people here have actually seen a case of smallpox? You've seen a case of actual, no one here has actually seen a case of smallpox. Now, if I would have asked this question in the year 1700, how many hands would have gone up? In approximately the 17th, 18th century, over 300 million people died of smallpox. How many people die of smallpox today? Zero. 300 million to zero. Vaccination is one of the most extraordinary advances in medicine. It is not simple treatment. There are indeed some side effects with it. The medical community has accepted it over many centuries. There are fascinating halachic discussions in the 1700s with the initial vaccinations, whether it's permitted or not permitted. Fast forward to today, the entire consensus, major consensus, overwhelming consensus of the entire rabbinic community is that not only is vaccination an extremely important and valuable tool that we should all avail ourselves of, but there's some even like Rabbi Yoshiv Zatzal of blessed memory who maintain that one could even coerce people to vaccinate. So the question is, what happened with some members of our Jewish community? How is it possible that these small pockets of Jewish community have become so-called anti-vaxxers? It's not a simple answer. I don't have a clear sociological understanding of that evolution. There are anti-vaxxers in all stripes and sizes across the country, so surely within our community there will be a small percentage as well. What unfortunately tragically happened by virtue of a very interesting circumstance is that the Jews have been singled out for spreading this unique measles epidemic over the last period of time. And in fact, here's a tragic historical irony. Back in the Middle Ages, the Jews were always blamed for spreading disease. The Jews poisoned the wells. The Jews were responsible for the Black Plague, for the bubonic plague. The Jews were actually burnt at the stake, thousands of them. However, there was no basis in truth for that. The Jews never had anything to do with spreading disease. Fast forward to the 21st century, now you read in the newspapers that the Orthodox Jews are responsible for spreading disease. It is actually true. There is more than a kernel of truth to that. So there's much to talk about, but let me share with you one fascinating observation. There are many anti-vaxxers, thousands of anti-vaxxers across the globe. So why is it that the Orthodox Jewish community is the one that contracted the disease and spread the disease amongst their community? The reason is all these anti-vaxxers don't live anywhere near each other. They are not a community. But there are pockets within the Orthodox Jewish community of hundreds of people that don't vaccinate, many of them who have many children in their families. So if measles spreads in that community, if measles is found in that community, it spreads like wildfire within a very short period of time. Measles is the most contagious disease in all of the world. It's not the most fatal disease, very thankfully, but it's the most contagious disease. If someone walked into this room with measles, they say that roughly 90% of us, if we were not immunized, would contract the disease. So there's a lot to talk about. The Jewish community, there are small, maybe Rabbi Breitowitz wants to comment, there are small pockets of rabbis also that don't support vaccination, but they are a decided and distinct, tiny minority, fringe. They do not represent in any way, shape, or form the Orthodox approach or tradition with respect to vaccination.
I just want to say just a few words to add. The Supreme Court of the United States many years ago declared that vaccinations are unavoidably unsafe, meaning to say, obviously there are some side effects. Obviously, there is a small percentage where there could be some serious repercussions, and if you're on the receiving end of that, statistics don't really make a difference. 1 in a million is not a comfort when you're the 1 in a million that gets sick. However, the truth of the matter is all medical treatments have risks, and society has to make a decision of risks versus cost versus benefit. And even though if it would only be relevant to my child, perhaps I as a parent could make a decision what risks I want to assume. But when your decisions will have an impact on the health and welfare of others and could actually cause death, or in the case of rubella, birth defects if a pregnant woman were to catch it, at that point, you can't be, a famous statement, you can't be a tzaddik on somebody else's calculation. So I think what is going on here is that a kernel of data which illustrates the occasional side effect has been whipped into a frenzy and almost a mass hysteria. I mean, I have anti-vaxxers actually, they make some valid points, but it's built into something that's a crescendo of exaggeration and hyperbole added to some totally discredited science, such as the link to autism. And as a result, it's playing on people's fears, and there are really drastic consequences, both resulting in death, and I pray and I hope it will not result in some rise in anti-Semitism by analogy to the bubonic plague.
Thank you very much.
Just a brief comment about the autism issue, just to clarify the latest research about autism. So Dr. Andrew Wakefield, a number of decades ago, was responsible for the original article in the journal called The Lancet. That article has since been discredited. The ethics, the research ethics have been found to be immoral. And if you actually go to the Lancet website, you will see a huge red stamp across the article that says retracted. And it's a rarity in the medical literature to retract literature. But you could say, so maybe his article wasn't correct, but maybe others supported that research. So just within the last few months, there was a article that came out, over 600,000 people in the study, and they found absolutely no association with autism and vaccination. So this study, it's a very detailed study, very well done study. This study, in essence, puts the nail in the coffin of this perception that there is an association with autism and vaccination.
Thank you very much. I have many more questions, but I definitely want questions from the crowd. This will be my final question, and then we'll turn it over to you. Rabbi Breitowitz, many young people in this country are vaping now. A number of years ago, the Rabbinical Council of America, as well as Rabbi Eliezer Waldenberg, a renowned posek in Jewish law, said that smoking was forbidden. How does the conversation move to this newer phenomena of vaping?
You have to explain to me what that is. I'm trying to know. Oh, electronic cigarettes? Okay. Well, sorry. I heard the word, but I just it slipped my mind. You know, the issue, I think there is a session, I'm not sure if Dr. Reichman is giving it or someone else is giving it, a whole session on the history of smoking in halakha. It's very controversial, halakhically, in the sense that on one hand, it's patently obvious ever since the Surgeon General's report that smoking does create grave risks of lung cancer, emphysema, and the like. And yet, the halakhic system has been a little slow to absolutely condemn it like treif, like pork or whatever it is. And that's a little incongruous because, after all, it's basic halakha 101 that you're not supposed to engage in behaviors that create unreasonable risks and dangers to your life, even if it's a long-term type of thing. Why the halakhic system has been relatively slow in prohibiting smoking is an interesting question. That's the interface of sociology and psak, which is perhaps deserving of a topic of its own. Perhaps people wouldn't listen. Perhaps you have the old idea that the damage of smoking is more cumulative, so any individual cigarette you cannot automatically say it shortens your life and the like. You know, we don't know exactly. But still, the typical Rabbi Voldenberg, assered it, he prohibited it. The typical posek will say, don't start, absolutely don't start, but they won't necessarily prohibit it for various reasons. Now, the vaping, I'm assuming, again, you have to educate me a little bit. Does it have the carcinogenic dangers?
So I'll be happy to.
Okay, so once again, if it does not have the same health risks, it simply gives you the high or the pleasure that's equivalent to tobacco, then it might be a vice, it might be a hedonistic lust, which we try to minimize. But obviously, if it is a healthful substitute, I don't think we can talk about it as being prohibited unless it's somehow a gateway to tobacco or to drugs or something else. So I would have to say that if indeed it does not have the health risks, it would be a very welcome substitution. Well, let's hear from the doctor.
Cigarettes are perhaps the only product freely available on the market which, when taken as directed, can actually kill you. Cigarettes are no question that they have essentially no positive value, only negative. It is true, as Rabbi Breitowitz Shlita points out, that the rabbinic authority, the rabbinic decisors poskim took some time in terms of transition to prohibit it. But today, the overwhelming consensus of rabbinic authority is that smoking is prohibited. Now, let me just clarify. Jewish law is a system of obligations, not a system of rights. So in America, obviously, we can make something illegal, so they can make smoking or drinking illegal like they did in times of the Prohibition. But in halacha, we don't give people rights or privileges, we give people obligations. So it is indeed possible for rabbis to say it is prohibited, it is asur for you to smoke, because smoking causes harm to your body, danger to your body. This is part of this session is part of the medical conference. That's really a fundamental theme which runs through almost all the medical issues we discuss. Are these products or medications that we take, are they life-saving? Are they dangerous? Can one engage in risky behaviors? Can one jump out of a plane? Can one go skiing? Can one go bungee jumping? Rabbis actually comment on the risk of certain behaviors, the risk of certain professions even, whether it's halachically permitted to do so. So the question is, we know for sure what the risks of smoking are. Those have been well established. The associations with cancer are very clear. Question is, so-called vaping or electronic or e-cigarettes, what is indeed the health risk? Is that risk different than the other risks? So there is no question that electronic cigarettes are less dangerous than conventional cigarettes. There's less association with the harms. That does not by any wild imagination make them safe or beneficial. They are clearly not beneficial. They are simply less harmful. They still have the nicotine, and they have other products that are associated with, in order to vaporize, in order to facilitate the ingestion. There are other associated products, all of which are potentially harmful. The major concern is in the youth, is the fact that the nicotine and vaping could potentially cause significant brain impairment and damage for people that smoke in their youth before the age of 25 when brain development occurs. And there has been an exponential rise in the amount of electronic cigarette use amongst the youth in our country. A very high percentage of high school students admit on surveys to starting vaping over the last year and continuing to vape over prolonged periods of time. So that is a plague, and that is something which is profoundly, seriously concerning, should be to the Jewish community and to the community at large. Question is for the adult community, what is the value of e-cigarettes? So there's proposed, so if you ask, obviously, the e-cigarette company, they'll tell you the following. They'll tell you this is a wonderful mechanism or tool for people trying to wean themselves off of cigarettes. And indeed, in the ideal world, if someone is smoking cigarettes, we believe cigarettes are prohibited. They can transition to e-cigarettes with the ultimate objective of weaning themselves off of e-cigarettes and then not smoking at all. In the ideal world, that would be wonderful. That would clearly be halachically permitted. The problem is that's not what actually happens. That the literature that's evolving seems to indicate that many people who transition from smoking to vaping don't stop the vaping. Many of them even continue smoking. So it's going to take a number of decades for the literature to evolve in terms of where this is going to head. But in terms of prohibiting e-cigarettes, the way the rabbis prohibited cigarettes, we're definitely not at that stage yet. I think also we're going to have to wait in terms of the evolution of the literature to see the objective medical side effects and harms of e-cigarettes before the rabbis could potentially consider prohibiting those as well.
If I could just share a little bit of an anecdotal impression. I live in Israel right now, and I remember years ago when I visited the religious neighborhoods of Israel, Mea Sharim, Geula, there were literally the proverbial smoke-filled rooms. You could not walk into a Beit Midrash without being choked by secondhand smoke, which itself has its own dangers. Everybody smoked. Little kids were smoking. I mean, basically, it was totally, totally rampant. And I have to say that in recent years, the situation has greatly improved among the ultra-Orthodox, among the Hasidic communities. There is far less smoking than there used to be. So even without the formal pronouncements, and as Rabbi Reichman said, there indeed have been some formal pronouncements, I think there's a consciousness, why start down this road that inevitably is going to lead to at least serious illness, if not premature death. So this is very welcome. I guess what I'm hearing is I'm very afraid that providing substitutes that themselves do have some element of danger, albeit less, we might be hurting the trend, which was getting people away from this, by providing certain substitutes that also have very, very negative effects. So I very much hope that I'm not going to be inhaling smoke-filled rooms, even with vaping and the like, because I think overall there's been a very positive development, at least among the religious communities in Eretz Yisrael.
All right, thank you very much.
I'll repeat the question. The question was, secondhand smoke in e-cigarettes, is it harmful or not? It contains nicotine. The secondhand smoke still contains nicotine. Nicotine is harmful. Nicotine itself is addictive. It also has additives which are vaporized into the air, which could cause potential cancer-causing agents, potential lung disease-causing agents, and for sure for younger people, potential impact on brain development. So, at this stage, it's not so clear, but it seems to be that there at least is some risk. It's clearly not completely safe. The question is it an acceptable threshold of risk, or does it rise above the threshold of risk? But it's definitely not completely safe. I definitely would err on the side of caution. It's not the kind of thing you want to be proven wrong down the line. At this stage, when we simply don't know if the secondhand smoke is harmful, I would assume it is until we know to the contrary, because we know for sure that its parent, the original cigarette, is undoubtedly harmful in terms of secondhand smoke.
Okay, all the way in the back.
So the question was, is there non-kosher derivative in the vaccine which would preclude us in the Jewish community using the vaccine? So let me take you back a few hundred years to the original vaccine. the smallpox vaccine, and share with you the story of to my knowledge, the very first Jew who claimed religious exemption for vaccination. This was the late 1800s in England. It's a man by the name of Mr. Levy. In those days in England, smallpox vaccination was required. Mr. Levy was a Jewish man. He said, I'd like to claim religious exemption. Or he didn't say religious exemption, he said, I'm not going to vaccinate because my Jewish religion prevents me from doing so. He said, why? Because in those days, the original Jenner vaccine came from cows, diseased cows, who had cowpox. And his contention was that this animal, if I slaughtered this animal, would be treif. I wouldn't eat it. So how can I take an animal that I wouldn't orally ingest and now inject it into my skin? So he was thrown in jail. And the person who threw him in jail the prosecutor was a Jewish man. And he felt really guilty. He said, I put my landsman in jail. Maybe he's right. Maybe he can claim religious exemption. So the answer, so what did he do? He went to the chief rabbi at that time. I think it was Herman Adler. Right, so I thought it was, you're right, it was Herman Adler. And he went to the chief rabbi, and he said, Chief Rabbi, is he correct in claiming this? So the rabbi said, absolutely not. Said vaccination is a proven effective treatment. There is no religious exemption. This is just with one vaccination, smallpox, back in the 1800s. And a common misconception is that just because it contains non-kosher products, that you can't inject it into your skin. The prohibition, this is an important clarification, the prohibition of treifus, of eating pork, is just that, is ingesting it orally. There's no prohibition of injecting it into your skin. So even if it were 100% porcine, 100% pig, there would be no halachic prohibition to inject it. And in fact, there are people here in this room, if you're diabetic, who may have used in the past insulin derived from pigs, porcine insulin. There may be people sitting in this room who have heart valves that derive from a pig or from a cow that wasn't shechted properly, bovine valves or porcine valves. All of those are absolutely no problem whatsoever. And even ingesting orally could potentially be permitted if it's for pikuach nefesh purposes in order to save a life. So that should be. I understand. And by the way, there was a New York Times article which said that explicitly. That should be completely discounted, completely dismissed. Is absolutely no reason not to vaccinate.
Yeah, I just want to add that when the Torah says you're not allowed to eat something, like a pig or whatever it is, eat is a very specific activity that does not apply to any type of injection. And indeed, even on Yom Kippur, when one is not allowed to eat, so the use of suppositories, caffeine suppositories, might be permitted because it is not an ingestion derech achila. There was a discussion a few years ago about a heart that might be gotten from a pig, and could a Jew get a heart transplant of a pig's heart? And it was interesting. This was a question that was raised in the Reform movement, and I was wondering, if you can eat it, why can't you? Okay, whatever. But but the basic rule is, as Dr. Reichman said, even if you're allowed to eat it, there is no problem. Now, he did raise a second point, and this would deserve a session of its own. In other words, point number one is, if it's just being ingested, there is no violation of the kosher laws. That's 100% true. Point number two is that even if you'd be ingesting it by mouth, the argument would be under the laws of pikuach nefesh, you would take it that way. That's a little less certain because in any given case, it may not be an imminent type of risk. That would be a debatable one. But as I say, that's theoretical given the fact that the vaccination is not delivered orally, and consequently, there is simply no infraction. If there's no violation of kashrut, there is nothing wrong with getting the non-kosher ingredient into your body.
I just have to share with you, because I heard Breitowitz's anecdote about the Reform movement and an ingestion of pork. It reminds me of a story from the Israel Health Organization at the time that swine flu was very popular. Swine flu was a flu which afflicted pigs and also afflicted human beings. I actually saw cases of swine flu in the emergency room probably about, it's now 5-6 years ago. So this is in Israel, where not everybody, of course, is Orthodox, not everybody's keeping kosher, not everybody's Jewish, So there was concern in the state of Israel in the face of swine flu whether it was permissible to eat the pigs, to eat pork, to eat bacon. So the Israel Health Organization came out with a pronouncement, and it was in Hebrew. I'll say the phrase in Hebrew so you understand what the hilarity of this comment. They said, indeed, it is not a problem to eat pig, even though there is an epidemic of swine flu, as long as the meat is bushal kahalacha. As long as the meat is cooked according to halacha. The word halacha has a number of different meanings. One of them is thoroughly and completely, as opposed to halacha in the sense that we understand it.
Thank you very much. You can go ahead.
The question was raised about organ donation, the halachic position on organ donation, and the particular case of receiving bone from a donor who died. In this case, it was from a non-Jew. And what would halacha say about that in light of the general imperatives of burying a dead body and treating dead bodies of both Jews and non-Jews with a certain measure of respect and the like? Well, there are a number of issues here, and indeed organ donation is complicated because it involves two separate issues. One is the issue of taking from the dead body and cutting up a dead body, but the primary issue in organ donation is not taking from the dead, but rather what is the halachic definition of death, because typically, at least the standard, let's say, heart transplant would be from someone who is technically brain dead, but they're on a respirator, and therefore the heart is still pumping on because of its own pacemaker, and halachically, therefore, you're not necessarily, well, this is the question, are you taking from a dead person, or are you taking from a live person, which would make it murder? And that is a huge, huge issue. That is the famous or infamous brain death controversy in halacha. The Rabbinical Council of America, Rav Moshe Tendler, many other rabbis, including Rav Yosef, have taken a permissive position on this. Most of the other poskim, Rav Yashiv, etc., tended to be very, very strict. And that's a totally different issue. That is whether reliance on brain death would effectively be legitimating murder or not. But in the case of something that is clearly being taken from a cadaver, someone that is clearly dead, so here, although it is true that halacha prohibits generally, dismembering or taking parts of a body, but certainly when it will be potentially life-saving, number one, it's absolutely permitted. And number two, even if it's not a question of saving a life, it's a question of giving somebody mobility. There is an interesting concept in halacha that once the fragment of a dead body becomes integrated into a live person, it now acquires the status of being alive. It's part of that recipient's body. So as a result, although we would not necessarily encourage a person to be a donor of their cadaver, as it were, certainly I don't think there's any halachic problem with a person being the recipient. Now again, this should not be extrapolated to the brain death controversy where you have other considerations, but at least in terms of receiving cadaveric tissue or bone, I don't think there would be a problem there.
So the question was about living organ donation and selling one of your organs. So Rabbi Breitowitz discussed some of the issues related to donation after death. This question is about a different aspect of donation, that's donation from the living person to another living person. The issues related to here are fundamentally different. The issues related to cadaveric donation include deriving benefit from the dead, and etc., and the requirement to bury. The issues with respect to live donation affect both the donor and the recipient. Indeed, donors, or all of us, have an obligation of lo ta'amod al dam re'echa, of not standing idly by as the blood of our brethren is being shed. So that obligation includes a certain amount of requirements. The Talmud, for example, says that one is required to physically do it if he or she is able to do it, required to spend money, and there's a debate about how much money, what percentage of your finances or your estate you're required to spend. The Talmud doesn't explicitly address the issue of risk. It's addressed more explicitly in a later responsum in the 16th century, as a responsum of Rav David ben Zimra, the Radbaz, from whom it is derived that indeed to save another life, one is obligated to incur a certain amount of risk. That question, when first asked in the 1950s, when kidney donation was first started, some rabbis assessed the risk to the donor and saw that there were some fatalities associated with donation of kidney back in that period of time, and said that based on the position of Rav David ben Zimra, it might indeed be prohibited to donate a kidney back in the 1950s and the 1960s. But as we must do with all matters of the relationship of medicine and Jewish law, we have to reevaluate continually with the progression of medicine and see what the situation is today in 2019. In 2019, there have been statistics of thousands and thousands of people who have donated kidneys, thousands of people who, for some reason, lost a kidney and are living with one kidney. And the risks, while admittedly clearly still there, it is still a surgical procedure, and anytime you open up the abdomen and you put a scalpel in the abdomen, there is risk involved. It has been proven significantly safer, to the extent that today there's not one single rabbi on the face of the earth, to my knowledge, who would say it's prohibited to donate a kidney. And in fact, many rabbis think it is an extraordinary, tremendous mitzvah. For those of you who are not familiar, there's a relatively new Jewish organization on the scene called Renewal. Anybody here familiar with the organization called Renewal? A handful of you. Renewal is a shidduch organization of a different kind. It actually helps people who are in need of kidneys find altruistic donors to supply those kidneys. Through its efforts, they have accomplished over 600 kidney donations. It is a staggering number in a relatively short period of time. It is clearly halachically permitted to serve as a kidney donor. With respect to your question about selling kidneys, I'll share with you a personal story. So I wrote with Dr. Fred Rosner, who's one of the icons of Jewish medical ethics in the late 20th, early 21st century, who wrote many works on the field. And we wrote an article together on selling kidneys, reviewed the halachic literature. And one of the interesting sources, by the way, comes from a Shakespearean reference from Shylock and the Merchant of Venice, about a pound of flesh. Can you claim a pound of flesh? And the question was, do we own our bodies? Can we sell our bodies? So to make a very long story short, it is halachically permitted to sell, but it's not framed that you're selling a piece of your body that you own. You're simply receiving compensation for your efforts, for your lost wages, for your lost time, et cetera, et cetera. So it is, according to many, almost all rabbinic authorities, permitted to receive some financial compensation to serve as an organ donor. So that's the way we wrote that article, and Rabbi Aaron Levine of blessed memory, was the editor. He was one of the giants of business law. And we left our conclusion that it's permitted to sell an organ. Just at that time, there was a scandal that came out in the Orthodox community of selling of kidneys in the black market. This is about 10 years ago, I guess, or now. So Rabbi Levine says you have to put an addendum there that if the law says that it's illegal to sell a kidney, then you have to abide by the law of Dina de Malchuta. Dina, it's one of the important principles of Jewish law, of which he was one of the world's experts. So he made us add that addendum in the chapter. But from purely Jewish perspective, it would be permitted. It may not make good public policy. It may not be the appropriate thing to do necessarily, and even Jews might say it's not a good idea to do, but from a pure halachic perspective, there is actually no clear prohibition of selling kidneys.
Yeah, I just want to add that although, as I say, as Dr. Reichman said, virtually every rabbi, perhaps every rabbi, has said it is a great mitzvah, it's a great merit to save a life by donating a kidney. It's absolutely not prohibited. It has still not risen to the level of obligation. The concept of surgical risk still says you're not obligated. Now, based on this, there was a case in Israel around 15 or 20 years ago, really a very tragic case, and I don't remember all the ages, but essentially somebody needed a kidney transplant, and the only suitable donor was a sibling who was below bar mitzvah. And the sibling wanted to donate, and his parents wanted him to donate, and the brother was willing to accept. And yet there was a psak that because there is no obligation to do so, it must be through free and informed consent, and a child below the age of majority was not capable of giving consent. If it would have been an obligation, then perhaps that would be a chiyuv, a mitzvah. So as a result, I believe it had a very, very sad ending that the older brother did not receive the transplant. The older brother died. Now, you could debate, and the court also said that the parents don't have the right to make that decision because although parents do have both secularly and halachically the right to make medical decisions for the benefit of their children, they cannot make a decision to put one child at risk for the benefit of another. That is not within their legitimate scope of parental authority. Now, one could question that halachic analysis. One might say it's in the best interest of the younger brother to have an older brother that will survive, and there's also issues of psychological guilt, although it wouldn't be warranted, etc. But nevertheless, the underlying principle seems to be a sound principle. And if you think that sounds very harsh, let me remind you that under the secular law in many of the United States, a minor cannot consent to an organ donation, and the age of majority in the United States is a lot higher, 18 or even 21, as opposed to the age of 13 or 12 in the case of Jewish law. So there are still some interesting implications where although the risks are greatly, greatly, greatly lowered over what they might have been, the risk factor still plays into certain decisions that you're allowed to make or not allowed to make.
Thank you very much. You can go ahead. Yeah.
So the question is about suicide and the principle of a person who commits suicide tragically, if that person can be buried in a Jewish cemetery or not. But today, even if someone tragically commits suicide, all people who even are known to have committed suicide are buried in a Jewish cemetery. The assumption is that indeed, while they may have intended to commit suicide, at the end they may have regretted it, and there's no way for us to know. And the Talmud even records these fascinating cases that someone jumps off a building intentionally and declares he's going to jump off the building, but by the time they reach the bottom, they regretted their decision. And so in essence, we give them the benefit, every single person, the benefit of the doubt, that even if they intended to commit suicide, and today we add on to that they may have been depressed when they made that decision, and the depression may have impacted their decision-making capability. So where suicide comes into the issue, and we're not going to have time to discuss it extensively in this session, but this is a plague across the globe, is the medical community's involvement in the facilitation of suicide, or so-called assisted suicide. And it's becoming legal in state after state. The latest state, to my understanding, to accept it is New Jersey, but it's likely to become accepted in many states across the country. It's a serious problem for the Torah-observant clinician. So I was at a conference, speaking at a conference where it was mostly Canadian physicians. In Canada, not only is assisted suicide legal, but in certain circumstances, the physician has a requirement according to the law to proactively make a meaningful referral for assisted suicide. So the question is, if you're an Orthodox Jewish physician, how do you deal with that? So it's a very nuanced discussion, not such a simple answer, but it's putting the Jewish community in very uncomfortable situations. What's happening across the border to the north is moving here very rapidly. And that's a discussion that we in the Jewish community are having now and will continue into the near future.
Yeah, I just want to add that in Europe, there have been a number of countries that have legitimated physician-assisted suicide for many years. Among them were the Netherlands. And I believe some medical research has shown that at least over a certain period of time, over 50% of the assisted suicides were people suffering from treatable depression, meaning to say they were at a certain low, and they said to the doctor, help me take my life, and perhaps they could have been helped over it. Now, unfortunately, from a Jewish religious perspective, the movement to legitimate and legalize assisted suicide grows, and there's a lot of popular support. And part of that popular support is the fear that people have of being stuck with uncontrollable pain. And that's a tremendous fear that a person would understandably have. And yet, if one needs to understand the tremendous advances in pain relief in all sorts of ways, and if we somehow either communicated that and put the resources in the palliative care that could really give people a great reduction in pain, as well as a relatively good quality of life. We're not talking about knocking people out in medical comas. I think the support for assisted suicide would go down drastically. It's basically simply the fear of being stuck with no way out. And in reality, Baruch Hashem, one of the great, great advances of medicine is that many people, not everybody tragically, but many, many people can really, really be helped over severe pain.
Right. Thank you very much, Rabbi Breitowitz, Rabbi Dr. Reichman.
Thanks for watching. Click subscribe and hit the notification bell below for daily pearls of Jewish wisdom.